Good day, everyone. I am Christine Jewel Lagrimas, and I will discuss the purpose of workflow analysis. But first, let's define workflow analysis. This is the observation and documentation of a work process to understand and improve it. It is a foundational activity for any technology implementation or optimization effort. So, the fundamental reason why we analyze clinical workflows is to create a safer patient environment. According to Campbell et al., while technology is intended to improve care, research shows that implementing it without considering the user's actual workflow can create greater safety risk than having no technology at all. A prime example is the computerized provider order entry or CPOE. It often presents four core challenges, which are order entry errors, user issues, system limitations, and care transition issues. This is why nursing informaticists are essential for its success. As Thompson et al. Noted in 2016, by partnering clinicians with informatic experts, we can leverage the power of the electronic medical records to reduce readmissions and streamline transitions from hospital to home. Our goal is a model of patient-centered care that is cost-effective as it is clinically sound. Even though technology is recognized to have potentially positive effect on patient outcomes, the adoption of technology in hospital settings was low because the cost of technology. In response, government intervention has created powerful incentives for organizations to integrate technology and demonstrates its meaningful use in improving patient care. The shift toward technology was accelerated by the US government in 2009 through the American Recovery and Reinvestment Act. This introduced meaningful use of certified EHR technology. Meaningful use refers to the rules and regulations established by ARA, which is that stage 1 is focusing on capturing and sharing of data, stage 2 is focused on advancing clinical processes, and stage 3 is improving patient outcomes. With the new goal of paying for value and better care, the MACRA reformed medical care payments, which is quality payment programs for physicians. It has two paths. The first is the merit-based incentive payment system, and second is the alternative payment model, which I will discuss in the next slide. So why does the design of these systems matter to the hospitals? First, inefficient workflows are incredibly expensive. Redundant documentation alone can cost an organization between $6,500 and $13,000 per nurse per year. Second is when systems are slow or poorly designed, we see non-value added steps, tasks that waste time without helping the patient. Lastly is the lost productivity of healthcare workers, meaning less time at the bedside of the patient and more time struggling with the interface. In 2015, the Medicare Access and Cheap Prioritization Act or MACRA reformed Medicare payments by creating the Quality Payment Program. There are two paths under MACRA. First is the merit-based incentive payment system. This adjusts payments based on the physician's performance across multiple categories. Instead of a flat rate, the government adjusts their payment based on how well they do in specific categories. Second is the alternative payment model. This is designed for providers willing to take on financial risk related to patient outcomes. The provider or hospital group agrees to be held responsible for the total cost and quality of a patient's care. If they keep the patient healthy and the costs low, they keep a portion of the savings.
So, good day po everyone. So, for the workflow and technology po, when we say workflow, it refers po sa series of steps or tasks na fina-follow po ng mga tao in order to complete a job or process. So, sa healthcare po, ang workflow, it usually involves po yung multiple healthcare professionals such as nurses, doctors, and technicians po working together to deliver patient care. So, there are two common types po ng workflow. So, we have the sequential workflow and the parallel workflow. So, for the sequential workflow po, so this happens naman po kapag ang tasks po are completed one after another in order. So, for example po, una is yung patient admission. The next po will be the assessment. The next po will be the medication administration. And lastly naman po will be the documentation. So, for the second type po of workflow, which is the parallel workflow, so nangyayari naman po to kapag yung multiple task po, it occurs at the same time. So, for example po, while the nurse po is nag-check ng vital signs, yung doctor po is nire-review po yung lab results, and another staff naman po is nagpe-prepare po ng medication. So, understanding po yung workflow is important because technology po systems should support these work processes rather than interrupt them. So, for the next slide naman po. So, for the next slide po, when we say workflow analysis po, it is the process naman po of observing, studying, and documenting how work is actually done in a healthcare setting. So, its purpose po is to, first is to understand current processes. Number 2 is to identify problems or inefficiencies. Number 3 po is to improve how work is performed. So, the main result po of workflow analysis is called a process map. So, when we say po a process map, it is a visual diagram po that shows first each step po in the workflow. Next po is who performs the task. And third one is how information po moves through the system. So, this helps din po healthcare organizations to identify delays or unnecessary steps, to improve communication and training, and lastly po, to develop better policies and procedures. So, there are also two ways po of organization approach technology and workflow. So, for the first one po, is technology adapts to clinical workflow. So, the system po is designed po para po ma-match yung way kung paano po yung healthcare workers already perform po yung task nila. So, number 2 naman po is the workflow adapts to technology, which is more common today po. So, this means po na yung healthcare organizations, minomodify po nila yung processes in order to fit the available technology po, such as yung electronic health records or yung clinical decision support systems po. So, yung technology po can also support clinical decision making. It can also track po yung patient care processes, and lastly po, it can also improve yung patient outcomes. So, for the next slide naman po. So, for the next slide po, when developing po healthcare technology, designers po often study yung workflow first. So, in order po for this topic, which is the technology design using workflow, they observe po yung how healthcare professionals work and interview stakeholders like yung nurses, doctors, and administrators po. So, this information po, it helps them para i-design po yung technology that fits real clinical practice. So, for example po, sa intensive care unit or ICU, yung mga mobile applications po, it can combine data from different medical equipment. So, nurses po can easily see yung patient information in one place. So, yung approach po na to, ini-improve po yung system usability, yung efficiency po, and yung clinical decision making. So, next naman po is the clinical transformation, which refers po sa mga major changes sa healthcare processes that significantly improve po yung patient care and yung organizational performance. So, ang important idea po nito is to simply introducing new technology po, it doesn't automatically mean po transformation. So, yung real transformation po, it requires po, first, it requires yung changes in processes. Second, it requires po to have improvement or to have an improved patient experience. And third po, it requires po na magkaroon ng better clinical outcomes. Then, next naman po is for the guidelines for clinical transformation. So, for healthcare leaders po, should follow several principles. So first, leaders must clearly explain po why change is necessary. Second, organizations po must have a clear vision po ng future. Third po, experts should help develop solutions. Fourth po is the focus should always be better patient and clinician experience. Fifth po is organizations should not simply copy po yung old processes using new technology. And lastly po, for number 6 is small improvements po are helpful but they are not the same as true transformation. So next slide naman po. So for the patient room next or PRN po, so when we say patient room next or PRN, it is a modern healthcare concept po that allows po yung high-quality patient care to happen anywhere. So, hindi lang po inside the hospitals. So, for examples po, its examples po include yung community health centers, yung patient homes, yung ambulances, and yung remote care settings po. So, yung PRN po, or yung patient room next, it uses several advanced technologies po. So, the first one is the machine vision. When we say machine vision po, ito po yung cameras na nagbo-monitor sa patients or nagdadetect po ng movements nila. Second naman po is yung machine audio. So, ito naman po yung voice recognition systems para sa communication. And third one naman po is yung patient content interaction, which is the systems po na nag-aalaw sa patients to interact with health information. And for the fourth one naman po is yung sensors, which is yung devices po na nagmo-monitor ng patient conditions such as yung heart rate or movement po nila. And lastly po is the telehealth, which is the remote consultations po with healthcare providers. So, next naman po are the 5 goals po of PRN. So, for the first one po, is the easy button. So, yung easy button po is yung quick access po to important patient information. So, second po is the real-time knowledge, which is yung healthcare providers po, they receive accurate data immediately, so allowing po yung faster decision making. And for the third one po is yung automated documentation, which is yung systems po, they automatically record patient information, so reducing po yung time that nurses spend on electronic charting. And for the fourth one naman po is yung touchless technology. So this is monitoring naman po using cameras and sensors, which helps po na ma-reduce yung infection risk. And lastly po, for the fifth one, which is the flexible spaces. So, the patient care areas po, this refers po sa patient care areas that can easily adapt po to different needs. So, for the benefits naman po of PRN or the patient room next, so yung PRN po, it offers several advantages. So, for the first one, it integrates po yung real-time patient data into care decisions. Number 2 po, it improves po yung efficiency of healthcare providers. Number 3 po, it reduces unnecessary physical contact while maintaining quality care. And for the fourth one naman po, it enhances patient monitoring and safety as well as their engagement with their family po. And lastly po, it allows healthcare spaces to adapt to changing needs. So, that's all po for my part. Thank you po.
So, hi everyone. Good day. So, for my topic is about workflow analysis, optimism, and process improvement fundamentals. So, the workflow analysis studies how tasks are performed in healthcare processes to improve efficiency, effectiveness, and patient care delivery. And it can be used before, during, or after technology implementations. So basically, when we say workflow analysis is like chine-check natin kung paano ginagawa yung different tasks sa hospital, like tinitingnan yung step by step workflow process na ginagawa ng mga nurses, doctor, and other healthcare professional when providing care to the patient. So, yung goal neto is to identify if saan may delay, repeated step, or unnecessary processes so that we can improve efficiency and mas mapaganda yung quality ng patient care. So, for example na nga po dito is yung mga OPD. So, we all familiar naman po sa OPD, paano po nagpa-process yon. So, if step by step po susundan natin yung process sa OPD is masyadong mahaba and then time consuming po talaga. So, with this po, tinatry po nilang bigyan ng bigyan ng magandang solusyon kung paano mas mapabilis at mas mapaganda yung patient care sa mga hospital. Kasi imagine nung mga 2012 po ata, based po sa experience ko is habang po kami papa-check up is una OPD and then i-refer po kami sa since yung ano daw po sa akin is baka may possible UTI ako and then i-refer po ako sa other hospital na diagnostic or laboratory test po ako. And then, yung laboratory test is i-refer naman po ako sa doktor para maresetahan po ako ng gamot. So, nowadays po na mas nag-i-improve po yung mga technology, mas nagiging advanced. So, meron na po tayong tinatawag na EHR or Electronic Health Record po. So, one tap sa computer, makikita na po natin yung patient information, diagnosis, and then laboratory results, and then as well as the prescription of the patient. So, for work analysis, examine how work is currently done, identify inefficiencies, and design workflow. So, in this stage, ini-observe po kung paano talaga ginagawa yung work ng mga healthcare settings. Parang tinitingnan yung, gaya po ng sinasabi ko is, ina-analyze po nila dito paano po nag-work step by step yung mga tasks from admission hanggang sa discharge ng patient. So, sa BMC po, lately po or yung kanina po habang po kami nag-duty is nahalata ko po sa discharge process is napakahaba ng process, like ihintayin pa po natin mag Thursday and Friday para po ma-process po yung discharge letter. Kanina po, based po sa experience ko, meron pong patient na umiiyak since sobrang bagal po or delay po talaga yung process po ng billing niya, and yung ano rin po, yung PhilHealth din po. So based po sa masasabi ko po, if kaya naman pong gawan ng new innovation technology is mas better po kasi mas magiging smooth po yung workflow ng mga health worker sa hospital settings po. So, the purpose po kasi nito is to identify if may insufficiencies or workflow problems, so the process can be redesigned to become more organized and sufficient. So, for example po, kung ang nurse ay kailangan pang bumalik sa nurse stations multiple times just to check if patient orders that could indicate workflow issues that needs improvement. So, for example po, sa medications administration, if the nurse has to walk back and forth po, syempre po, usually po is nakakapagod po talaga yun, yung pabalik-balik po from nurse station to to medication room or patient room to check just to check the orders that maybe po magkakaroon po ng prone po to sa medication error or if insufficient care or ineffective care din po. So sa work analysis po, mapapansin po doon nila yung mga they can add a mobile device or bedside charting para mas mabilis po. So for optimism or optimism is the optimization is usually happen after new technology is introduced in a healthcare facility. So when we say optimism, when a hospital implement new systems such as electronic health records, the existing workflow may change. So because of that, the adjustment need to be made so the technology can be used more efficiently. So for example, when a hospital introduce a electronic documentation system, nurses may initially take longer to chart. Through optimism, the workflow and system design are adjusted, so documentation become faster and easier. So we as nurses or as student nurses, we all familiar po sa patient charting. So usually sinusulat po natin siya sa census handwritten, but with this improvement po, we can utilize this to make work easier and become faster po. So for next is process improvement. So the process improvement conducted independently of new technology implementations, focusing on improving operational processes. So unlike sa optimism, is process improvement does not necessarily require new technology. It's simple. Focuses on improving existing healthcare processes to make operations more efficient. So the main goal of this is to enhance the quality of services while reducing delay and unnecessary work. So for a example for this is sa outpatient clinic kung saan umaabot ng 2 to 3 hours bago matawag ang patient. So, kanina po, dun po sa BMC pag-duty po namin, sobra pong dami nung patient sa outpatient department po. Napapasabi po kami doon kanina is, kahapon pa po yung ibang patient, nakapila, just to, para lang po makalibre po, since ano po siya, public hospital nga po. So, talagang nagtsatsaga po silang, maghintay ng yung pangalan na po nila matawag. So with the help of this po, mas may improve po natin yung process and reorganize po natin yung step like sa registrations, assessment, and consultation para mabawasan yung waiting time po nila. So for the next slide is Role of nursing informatic professional. So the role of nursing informatic professional represent clinician needs in technological solution, act as liaison between healthcare staff and IT system, lead workflow redesign and operational improvements, apply change management to ensure staff adapt new processes. So for this po is the main goal of improving healthcare workflow is to achieve effective and efficient care. Effective care means best possible outcomes for the patient, while efficient care means less waste of time, effort, and resources. For example of this is to For example of this, kapag may bago hospital system, yung nursing informaticist, magbibigay ng feedback sa IT team, and then if masyado maraming clicks yung documentation ng nurses, then they help redesign the system para mas user-friendly siya. So, another example of this is in a way they serve as a bridge between healthcare provided and the IT team. So they play a very important role in workflow analysis and system implementation. They represent the needs and concern of nurses and clinicians whenever new healthcare technologies are introduced. So the next is the goal of improved care delivery. So, healthcare workflow improvement aims for effective care, best possible patient outcome, efficient care, minimal waste, time, motion, transportation, error. Methods used includes Lean or LEANS or Six Sigma. So, to explain this is the main goal of improving healthcare workflow is to achieve first yung effective care and then efficient care. Gaya nga po ng sabi ko, yung rule po ng nursing informatics is to give a effective care and efficient care. So to make this po is we will use some methods like to improve healthcare processes included I don't know what we call this, but Lean or Six Sigma, which help identify insufficient and improve overall workflow. So for a example of this is using a lean method para mabawasan yung wasted time, like preparing all needed materials before wound dressing so the nurse doesn't have to keep going back to the supply room. So the next topic is challenges in workflow research. So, limited research in clinical workflows study. Time study require large resources. Difficulty measuring workflow consistently. Patient privacy concern during observation. Lack of standardized terminology in workflow research. So, however, studying workflow in healthcare also has some challenges. So, for example, limited po yung research related to the clinical workflows. So, also conducting time studies require a lot of resource and manpower. Minsan, mahirap din po maging consistently measures workflow because healthcare environment are very dynamic. And then, of course, they are privacy concern when observing patient and healthcare workers. For example, is using if researchers want to observe how nurses work during a shift, mahirap kasi busy yung hospital. Bukod doon, may mga privacy issue if the patient are being observed while receiving care. So for example, very familiar tayo dito lahat. 'Di ba sa school when researcher conducted study and then sinesend po usually po kasi is nagka-conduct po ng participant, or what we call this is yung mga survey. Yeah, mga survey. So, pag sinesend siya sa GC, minsan dinededman ng mga student since yung iba, meron silang reason, privacy, and then yung iba tinatamad. Like, literally talaga silang tinatamad. And then, kahit i-mention sila sa GC, dedma pa rin sila sa mga survey. But, in other side, is nakaka-help din naman to para mas ma-improve yung specific problem na kailangan or particular problem sa specific community or specific school para ma-address ng maayos yung issues or problems, and then magkaroon po ng effective solution or effective innovation technology. So, ang kinaganda pa dito is since yung mga student or student nurses is highly kailangan po nila ng highly quality teachings. So now meron po tayong mga advanced technology like virtual reality. So dito, if may implement po natin yung virtual reality sa CHS, mas magiging reliable or mas magiging efficient po yung teaching po natin sa mga student nurses po. Since makikita na po natin yung mga 3D internal organs, and yun po, yung makikita na po natin yung reality model of anatomy. And then next slide is advanced workflow analysis. So dito meron tayong radio frequency gauges, track movement of clinical and patient, help analysis real workflow patterns, simulation next is simulation software. Meron po tayong two bullet dito. Yung first bullet is model clinical workflow before implementations. Example po na tools is ProModel, Maya, and Autodesk. So for this topic is for more advanced workflow analysis, hospital can use different technologies. For example, they can use radio frequency gauges to track the movement of clinical or clinicians and patient within the hospital. They can also use simulation software to model clinical workflows before actually implementing them in real life. This help health worker organizing test different processes and identify possible improvement. For example, so sa advanced workflow analysis is using a tracking gauges for nurses and doctor. This help researchers see how much time is spent in patient care versus walking or doing documentations. So usually, based po sa experience ko, is mas time-consuming is yung pagdo-document and walking po talaga. Kasi while doing the NPI, get a vital sign of the patients, administer oral medications, doing interview is very basic po siya. Like, hindi po aabot ng 10 minutes, tapos mo na po siyang gawin. And then after that, lahat ng mga ginawa mo, to document po natin. Siyempre, while doing FDAR, mag-iisip tayo ng focus, actions, and then I forgot the data, and then yung response. So, mas time-consuming po talaga yung patient charting. So, for me po talaga is very useful po yung EHR, and then hoping po na mas ma-improve pa po in advanced future po. So for applying external industry models, healthcare can adapt workflow methods from manufacturing, services industry. Benefits po nito is standardize the processes, improve performance, better quality outcomes. So for this sections is the industry already have a very structured and standard workflows that focus on efficiency and productivity. So by this po, applying this model, healthcare organizations can also improve their operational efficiency and overall quality of patient care. So as I said earlier, hospital can copy the system of fast food restaurant where tasks are standardized. For instance, the trade nurses follow the same step-by-step protocol to make patient assessment faster. So for macro level workflow analysis, modern healthcare requires analyzing the workflow across the entire care continuum. For example, is health information exchange, medical home care models, nursing informaticists mass analyze the patient improvement across multiple healthcare settings. So for this for this category is we have a macro level work analysis nga. So yung modern healthcare system need to analyze workflow not just within the one hospital but across the entire healthcare system. For example, is system like health information exchange allow healthcare providers from different facility to share patient information. So because of this, nursing informaticists can help analyze how patients move across different healthcare settings to ensure the continuous and coordinated care. So dito po sa Philippines is wala po tayong informaticist. Usually po ang gumagawa po nito is yung ang tinatawag nito coordinated or yung pinaka higher level sa charge nurse. So for a example of this is kapag yung patient na-admit sa hospital then later nag-follow up sa ibang clinic through health information exchange, the next doctor can see the patient previous record, so tuloy-tuloy yung care. So according to our clinical instructor on the subject is meron na daw pong an advanced technology regarding po dito na mas na-access na po yung patient information or patient records, na doon na po yung personal information, diagnosis, laboratory results, and then yung prescription po ng doctor. So with this po, mas nagiging smooth po yung workflow po ng health care settings. So very useful and then very helpful po talaga po sa atin itong mga new technology po nowadays. So that's all my part, sir. So the next reporter will be explaining the other part of our reporting. So that's all po, sir. Thank you.
Good day po. At this part, we will now po talk about the role of Informatics Nurse Specialist or the INS. So, according po to the American Nurses Association or the ANA, one of the main functional areas daw po of the Informatics Nurse Specialist is the analysis, particularly po sa workflow analysis. Workflow analysis po is important because it helps assess and improve kung paano po nakiki-interact ang mga healthcare workers sa technology or what we call the human-computer interaction. So, in the healthcare settings today po, yung mga nurses and other clinicians use many technologies gaya ng electronic health records, barcode scanners, and yung mga other digital systems na rin po. And dahil dito, it is very important po that the workflow or yung sequence of task is efficient and well-designed po. Kasi po, if hindi po efficient ang workflow, it can negatively affect patient care, which will also cause delays or even increase po the risk of errors. So, dahil po dun, very important po talaga ang role ng nursing informatics. So, yung mga informatics nurses po, they help analyze existing workflows and redesign processes po to make them more efficient, safe, and supportive of patient care po. Additionally, the American Nurses Association po, sinabi rin po nila na ang workflow redesign daw po is one of the fundamental skills sets of an informatics nurse specialist. So, this means po, they must be able to identify problems in processes and help improve them po. Especially kapag may new technologies po na tig-implement po sa healthcare organizations. So, in this slide po, basically, ang informatics nurse po, they check how nurses and staff use technology, identify workflow problems, and helps redesign processes for safer and smoother patient care po. So now, let's move on po to building the workflow redesign team. So, ang workflow redesign po is not done by only one person. Instead, it requires an interdisciplinary team composed of different members who are involved po in the workflow. And isa na po dito sa important group in the team is what we call the process owners. So ito pong mga process owners na po ito, they are the people who actually perform the task in the workflow. For example, ito po yung mga nurses, physicians, pharmacists, or other healthcare staff po who are directly involved in the process. So, these individuals are important kasi po, they understand the real situation of the workflow, including the variations and challenges na nag-occur po sa daily practice po nila. However, aside po sa process owners, it is also important po to include yung mga decision makers, gaya ng mga managers or supervisors po. Kasi po, they have the authority to approve changes and implement improvements in the process po. And a good workflow redesign team po should have a balance between these two groups. Kasi po, if the team only includes managers, they might make assumptions po about how the workflow works without fully understanding the actual process po. And on the other hand, if the team only includes staff po without the decision-making authority, yung mga improvements po, it may be delayed kasi nga po yung approvals must come from outside the group po. And another important step po is defining the focus of the workflow analysis. So, the team po must clearly identify the beginning and end of the process, and dapat po mag-focus din po sila first sa mga major steps po rather than sa mga small details. And a common principle used po sa workflow redesign po is the phrase, stay as high as you can, as long as you can. So, this means po na ang team daw po, they should first look at the overall process before going deeper into the detailed steps po. And that's it po for my part. So, summary lang po, we discussed the role of the informatics nurse specialist in analyzing workflows and yung importance din po of building the right workflow redesign team. So, ngayon po, now that we understand who is involved and why workflow analysis is important, my group mate now po, Rena's Rule, will now continue the discussion by explaining po the different techniques used to analyze and improve workflows po.
Good day, everyone. So today I will discuss about process mapping and analysis techniques. So first, what is process mapping? So this is a method used to visualize the workflow and roles of individuals involved in a certain task. So this is commonly done using swim lane diagrams, wherein it helps us identify who is responsible for each step and how tasks are transferred from one department to another. So this process mapping or the swim lane diagrams, it allows us to clearly understand how the process flow within a hospital or within an institution. So the next topic or the next subtopic would be the observation and interview. So in this technique, we observe staff while they are performing their actual duties. We also interview them to ask about the challenges they encounter, the possible delays in their work, and shortcuts that they sometimes use. So in this, it helps us gather accurate and real-life information about how the process is done. Next is for waste walks. So waste walks involve identifying inefficient practices in the workplace. Example include unnecessary movement, repeated handling of materials or documents, and redundant tasks. By recognizing these inefficiencies, we can find ways to improve productivity and reduce wasted time and effort. And lastly, the goal of these techniques is to accurately capture the current state of the workflow. It also aims to detect workarounds or process steps that may lead to delays or errors. So through this, organizations can improve efficiency, safety, and quality of services. Next is I will be discussing the value-added and non-value-added steps as well as the waste in the process. So value-added steps are the activities that improve the process or the outcome. An example of this is correctly labeling a specimen before sending it to the laboratory. So these steps are important because they directly contribute to patient safety and quality of care, and it also provides efficiency to the worker who is doing their task. So on the other hand naman, non-value-added steps are activities that do not improve the outcome. So basically, wala silang pinoprovide na advantages or proper contribution sa outcome. So mga unnecessary steps siya. Example po nito is mga unnecessary movement and excessive paperworks. So, ang disadvantage ng non-value-added steps, it may lead delay to the service and will only consume time and effort that wouldn't matter on the outcome or on the end process. So, the next is the 5 whys technique. So, in this technique, it involves repeatedly asking why a certain step exists in the process, because through this, it will be able to identify unnecessary steps or workarounds and find way to improve efficiency. Aside from that, let me also discuss the waste based on lean philosophy. So there are various type of waste which are overproduction, meaning that the person is doing more than needed, na mga hindi naman kailangan pero mas nagpapagod at mas may maraming ginagawa than required or needed. Next is waiting or idle time, transport or moving items unnecessarily, overprocessing or doing more than required, excess inventory or extra stock, unnecessary motion such as bending, lifting, and walking, and lastly, defects or rework or errors. And lastly, there is variation. This refers to doing the same task in different ways. So variation can cause inefficiency and increase the risk of errors. Although not all patient care tasks can be standardized, most processes can still be improved for better outcome. In conclusion, understanding value-added steps, reducing waste, and minimizing variation can help improve workflow, efficiency, patient safety, and overall quality of service. Lastly, I will be discussing about transitioning to the future state workflow. So, future state workflow refers to the ideal workflow that is achieved after redesigning or improving the current process. So, it represents a more efficient, organized, and safer way of performing tasks. Next are post-redesign steps. After developing the improved workflow, kailangan ma-document yung new process na mas clearly. Policies and procedures should also be updated to reflect the changes. In addition, staff and support personnel must be educated or trained regarding the new workflow. Monitoring should also be done to detect early failures or possible workarounds that may affect the effectiveness of the new system. Another important concept is gap analysis. So, gap analysis involves identifying the difference between the current workflow and the future state workflow. So, through this, organizations can determine what changes are needed to successfully implement improvements, or kung ano yung mga kailangan baguhin from the previous workflow in order to have a more developed workflow within the institution. So, in conclusion, the main goal of transitioning to the future state workflow is to achieve an ideal process that enhances efficiency and quality of service as well. So, that is all for my parts for this reporting. Thank you po.
So, good day everyone. I am Bianca and I am assigned to discuss informatics as a change agent. So, in this slide, I'm going to explain how nursing informatics helps bring change in healthcare since we're in a generation where technology continues to advance. So, healthcare systems also needs to adapt. So, it simply explains that nursing informatics aid in leading and managing change in healthcare systems due to advancement technology. So, with the help of the change agents, which are individuals who integrates change in a better way. So, in a healthcare setting, we consider change agents are the ones or are the professionals called as nursing informatists. These are individuals who introduces and manages changes in healthcare systems using advancement in technology and information system. So, basically, they are individuals who act as a change agent. They use technology and information system to improve patient care, communication, and healthcare processes. And not only that, they need to identify what specific problems are present in the facility so that they can aid the professionals or the individuals working in that service. So, change is often a slow process that requires continual positive reinforcement and involvement of supporting resources. So, as we all know, hindi naman talaga ganun kadali yung pag-adapt sa change, lalo't pat kung hindi pa tayo masyadong gamay. So, the question is, why the need of change in healthcare system? Magkakaroon ng change sa isang healthcare system or sa isang facility, of course, when there's a new advancement is present in this facility. So, for example, when there's a new technology is introduced, workflows are redesigned, policies are updated, and quality and patient safety improvements and requirements. So, of course, when new technologies are introduced, then we must improve the healthcare services in the facility. Second, workflows are redesigned. Why? Because we need to, or the technology need to be aligned with the professionals' workflow so that it will lessen any mistakes or errors during the workflow process of the individuals. Hence, it will make the task more efficient and effectively when it comes to patient care outcomes. Third, policies are updated to follow new standards and regulations. And these changes will help improve quality of care and patient safety. So for the third slide, according to John Cotter during 1996, one of the most widely recognized change theorists suggested that the following conditions must be addressed to deal with change in an organization. First is that we must have an education and communication so that people can understand the change. Second is participation and involvement. In this factor, it will allow the staff or the healthcare professionals in the facility to contribute ideas and to allow to have feedback. Third is to have the facilitation and support, which will help the employees to adjust to the new systems. And that is the primary goal of the change agent, because we want, or the change agents want everyone to adopt to the change para it will make the work effective and efficient. Fourth is that negotiation and agreement, cooperation, sometimes coercion means enforcing change when necessary. These factors help organizations adapt effectively to the new developments. So, as a change agent, let us look at this flow chart wherein so now that we are done in defining what is a change agent, what factors should a change agent must know in order to address changes in the facility, let us look at this flow on how does a change agent make or implement such changes in the facility. So first is we must identify the problem, because by identifying the problem, we're able to think what appropriate policies or implementation that we will make for the professionals. Second is to assess the current workflow of the professionals. So by assessing the current workflow of the professionals, the change agent will be able to know what things that will be needing to lessen or to improve. Third is plan what suitable information system is suitable for that facility. Next is to implement the choosing technology or system. So once na identify na yung problem, na-assess na yung current workflow, at nakapagplano na, we can now implement the chosen technology system. And once na nakapili na ng technology system, we can now educate and train the staff. So why the need to educate and train the staff? Of course, so that they are aware of the changes that is currently applied in their facility. Kasi if hindi natin sila educate and matitrain yung staff, then wala din naman effect yung in-implement na change sa facility na yon. Mas lalo lang lalala yung problema ng workflow or kung ano man yung nagpapabagal sa gawa ng isang healthcare professional. So, lastly, we must now observe the change adoption. So, for this one, there will be only two conclusion or effect. Whether the professionals in the facility are able to adjust or they are not able to adjust. Parang mas lalo lang sila nahirapan. So, for this one, it is very important to evaluate whether the individuals present in the facility are able to understand the change. Why? Because if hindi nila naintindihan yung change or yung new technology na na-apply natin sa facility nila, then it will affect their overall performance when it comes to patient care, and we don't want that. So as a change agent, we must always consider the abilities of the healthcare professionals in the facility so that they can continuously provide care effectively and efficiently in the hospital. So, yun. So we come now in measuring the results. So in measuring the result is very important para ma-evaluate natin whether the implemented new technology or change in the facility is working well or not. So with the help of the metrics, which is defined as an understanding about the performance of the technology or that capture the level participation or adoption are identified and collected. So, example of metrics, we have the turnaround times, changeover time, patient satisfaction, cycle time, setup time, employee satisfaction, throughput, system availability. So, these measurements or these metrics must be collected before the change so that we can have a baseline data and after the change to assess the improvement. So, in measuring the results, we focus on three main factors. First is the time, how fast the process happened. Second is the quality. We assess whether the error rates are lessened or the patient outcomes are amplified. So third is the cost, how many resources are used. So as I've said that these metrics or measurements must be collected before the change since it will serve as our baseline data and after the change to assess improvement. So why do we need to measure the results? Of course, para malaman natin if yung na-implement na change or the new implemented system in the healthcare facility is doing well both in the workflow of the individuals and the professionals. So for example, nag-implement tayo ng EHR, that is the change agent in the facility. And ang baseline data natin is before the implementation of electronic health records, parang mas nabibigyan ng oras ng bedside nurses yung pag-document instead na mag-handle ng patients nila. So, now, na-implement na yung EHR sa facility. And after na ma-implement ng EHR dun sa facility nila, parang nag-improve yung na-lessen yung time sa documentation ng mga bedside nurses when it comes to charting. And napunta yung more time na yun sa pag-alaga ng kanilang mga patient. So that is the importance of measuring the results so we can assess whether the change agent or the new implemented system is doing well or not. So to determine whether the change agent has an improvement or not in the workflow of the bedside nurses or the healthcare professionals in an institution. So in order to measure the results, we can base on this flow chart. First is we must define the goals of the improvement. Second is to select the indicators or the metrics that will show whether the goals are being achieved. So, based sa mga sinabi kong metrics kanina, pwede tayong pumili dun if ano nga ba yung gusto nating mabago. Pero it depends on an institution kung ano yung need nilang i-change. So, for example, sa BMC, diba, until now, nasa paper charting pa rin sila, pero I think they are slowly adopting to EHR. So, yun, pwede natin yun maging indicator. So, we will focus on the setup time, patient satisfaction, and employee satisfaction. Pwede yun. So, third is to collect the metrics. We must collect necessary data. After collecting, we must analyze the collected data whether, parang for example, marami ba yung naging masaya or naging moody sa new implemented system. Importante yun para ma-assess if the new implemented system is doing well or not in the facility. Next is to compare the before and after of the metrics. So why do we need to compare the before and after of the metrics? Of course, to evaluate whether the change agent is doing well. Paulit-ulit ko siyang sinasabi kasi yun yung purpose ng change agent. And ayaw naman natin na yung change na tig-implement sa isang institution ay hindi sang-ayon sa healthcare professionals na gumagawa nun. Kasi if it is not aligned with the workflow of the professionals, then it will affect their overall performance when it comes to delivering patient care, and it will not be effective and efficient, and it will only increase the risk of errors. So lastly, we must evaluate the change to determine if the improvement was successful. So that is and that ends with my discussion po regarding to informatics as a change agent. Thank you.
So, good afternoon, everyone. For my part, we will be talking about quality improvement in healthcare. So, first, let us define quality improvement. So, it is a systematic and data-driven process aimed at achieving measurable improvements in healthcare services and patient outcomes. So, QI daw po is a systematic or a step-by-step process that in order to be achieved is we rely on data in order to measure the needed improvements in healthcare services based on yung mga patient satisfaction po and other criterias. So, it involves continuous actions and evaluations to improve healthcare systems and patient care. Like I said po, it is systematic. So, continuous po ang action and evaluation so that there will be improvement. And then, nurse informaticists play an important role in analyzing data, improving processes, and supporting healthcare teams. So, yung role po ng nurse informaticist is to analyze the data given to them and then to suggest or improve the processes of the current healthcare services, as well as to support the healthcare teams by giving advices and giving their expertise. And then, the common areas po that we use QI projects. This is according to Health Catalyst to 2022. So, we have is yung clinical variation, preventable medical errors, hospital-acquired infections, delays in patient discharge, and financial issues. So, this po are the areas kung saan ginagawa po yung quality improvement or ni-utilize po yung data from these areas para po ma-improve yung services sa patient care. And then, there is also selecting the right project. So, it requires a clear problem to be addressed, a strong and knowledgeable team. That's why po, when we're doing quality improvement, we involve yung mga nurse informaticists since ang expertise po nila is yung mga information systems po ng healthcare institutions and facilities. And then we also have effective processes and reliable performance matrix. So, yung matrix po is, as discussed before, is yung mga criteria such as yung time, yung yung time, quality, and cost po that provide us the understanding on how the technology or the current system is performing. For the next slide naman po is we are looking at the steps in a quality improvement project. So, as I've said before po, it is systematic. So, it is conducted by steps. So, the first one po is to select a QI team. So, it is important po na ang isa-select nating mga members of the QI team knows the workflow of the facility and has expertise regarding the problem and the processes nga po ng facility. We also have to choose the project based on performance gaps or organization goals and feasibility. So, dito po natin i-identify po yung problem or the performance gaps, and then i-identify po natin yung gusto nating maging outcomes and goals sa project po na ito. And then for the third step is we apply a SMART framework for the project. So for the goal po, dapat po ang pipiliin nating goal is SMART. So it should be specific, measurable, achievable, relevant and time-bounded po. And then the next step po is to develop measures to evaluate whether goals are achieved. So, like I've said before po, QI is a continuous analyzation and evaluation. So, need po nating i-evaluate yung goal po natin na in-identify during the project to determine whether na-achieve na po natin ito. And then, the next step po is to identify change ideas to address the issues. So, if the goals were not achieved po, we can identify change and that will further address the issue that was identified in the project. And then, next po is to make sure to test the changes to determine po yung effectiveness nung magiging change. And then next po is to ensure sustainability and spread of successful improvements. Because po, it is important po na sustainable po ang magiging project natin in order nga po to meet the matrix. Kasi part po ng matrix po ng isang healthcare facility or any healthcare facility is yung cost po natin. And then, the next slide po is we have the characteristics of effective QI change agents. So, each member po or the QI leaders should demonstrate this following characteristics. So, they should be enthusiastic po with the project, optimistic, curiosity, para po ma-explore nila yung mga possible na change or improvements, and then perseverance, strong collaboration and communication skills. Since nga po within a QI project, it requires a team, so kailangan po talaga na there is a strong collab and communication between the members or the experts within their fields. And then next po is the key principles of quality improvement. So, QI initiatives depend on 4 main principles. So, we have understanding the current system. So, dapat po ina-understand yung current system para po we can give the critic or ma-evaluate po ito to be changed po for the better. And then, the second po is to focus on patient needs and expectations. So, when doing a quality improvement po ng kahit anong area po sa isang facility, dapat po ang kinikeep in mind po natin is yung pangangailangan po ng patients and their expectations within the facility. And then, the third step po is promoting teamwork and collaboration. Since nga po ang quality improvement or QI is a teamwork. And then next po is using data to guide decisions. Kasi po in the healthcare setting, whether mapa-quality improvement man po ito or practice, it should be evidence-based. Thus po, very important po yung data sa make po natin ng decisions. So, these principles ensures that improvements are effective, patient-centered, and sustainable. And that's all po for our reporting for chapter 13. The next slide po will be our quiz na po. Or maybe po isisend na lang po to through G-Forms.